Okay, so if you are ever having to deal with a baby and having to do CPR, once first responders show up, they're going to deal with things differently than how you would do it in your clinic because they've got some more advanced training. So one of the things that they're going to do is pull out this little thing which is called an oral airway. And what it does is it actually sits into the mouth and opens the airway up so that you can get a consistent passage air through there, so you're not having to hold the baby's head or anything like that. So the way they measure it is they take the edge of it to the edge of the baby's mouth and drop it down, and if it reaches down to the angle of the jaw, then it's the correct size. So when they put it in, they're basically going to open or pull the chin down, and then they're just going to slip that right in, and it sits like this in order to hold the airway open. The other thing they're going to use is a bag valve mask, and what this does is instead of having to put your mouth onto the baby, because we should still be using protective equipment when we're doing this, they're always going to use a bag valve mask. So what they do is they put that over top of the baby's face, and then they just squeeze it in order to give the breaths. So just to show you what it looks like, because they'll do two-person CPR with it, my buddy Kevin's going to do the compressions for me. And now there's two ways to do compressions. You can either do it with the two fingers between the nipples like that, or you might see first responders actually grab the chest and do the compressions like this. And the other rule that they're going to follow is once it becomes two-person CPR, they're going to do 15 compressions to 2 breaths instead of the 30 and 2 that we were practicing as you were by yourself. So Kevin, if you want to start doing compressions. Fifteen. And one of the things, like you might see that looks like my hand is totally over the baby's face, but the one thing you have to do is keep a really tight seal with that so that air will still go through. 10, 15. Okay, that's good. So the other thing is you don't want to do, like when they're using it, they're not going to use a real force when they're doing it. It's very gentle for the same reason as when you're just giving the amount of breath that's in your mouth. So hopefully that'll make you feel a little bit more comfortable if you ever have to deal with this. Hopefully you never have to deal with it, but with the amount of people out there that are incorporating infant massage into their practice, a really good thing for all of us to know.